Hi everyone, my name is Samantha Koski and I will be providing the pharmacy updates for November. This presentation will include information about a new label change and various updates related to the treatment and prevention of COVID-19. First, we will discuss a new FDA label change. Brilinta or ticagrelor is a P2Y12 antiplatelet that has previously been used for prophylaxis of acute coronary syndrome and secondary stroke. On November 6th, this medication was approved for primary prevention of stroke based on the results of the THALES trial, which came out in July of this year. The study showed that ticagrelor, in addition to aspirin, reduced the rate of stroke and death by 17% versus aspirin alone, which is both statistically and clinically significant. Of note, prasugrel, a cousin of ticagrelor and clopidogrel, is contraindicated for this indication. Next, we will discuss the information that has become available for COVID-19 vaccine contenders. Here is a list of vaccine candidates found on COVID-19 Vaccine Tracker. All of the above are in Phase 3 trials, though not all vaccine candidates in Phase 3 trials are listed. We will focus on the first two vaccines and take a closer look into the preliminary results of the most recent trials. Pfizer's COVID-19 vaccine candidate, BNT162b2, demonstrated 95% efficacy of preventing contraction of the SARS-CoV-2 virus in the interim efficacy analysis of a Phase 3 trial for patients with or without primary infection of the virus. This trial currently has over 40,000 patients who have received the second dose, and Pfizer is reporting no serious safety concerns to date. Moderna also has a promising vaccine, which is another mRNA-based vaccine. This vaccine has a reported 94.5% efficacy. From its 30,000 participants, over 25,000 have received the second dose, and only 95 cases of COVID-19 have been confirmed. Of those cases, 5 were found in the vaccine arm, none of which were considered severe. All 11 severe cases were identified to be in the placebo arm. Next, we will discuss the medications that have been granted an emergency use authorization. Bamlanivimab is an IV solution that has recently been issued emergency use authorization from the FDA to treat mild to moderate COVID-19 in patients at least 12 years of age and weighing at least 40 kilograms. These patients must have received a positive viral test and be at risk for progressing to severe infection or hospitalization. No benefit has been seen in patients who are hospitalized to date. Dosing for bamlanivimab is 700 milligrams as a single IV infusion over 1 hour. There is currently no brand name available since it was not yet approved for use prior to the emergency use authorization. Bamlanivimab, as well as remdesivir, were added to Cone Health's formulary during P&T on November 18th. In mid-October, the WHO released interim results of the Solidarity trial, which showed little to no effect on COVID-19 in hospitalized patients with the use of remdesivir, hydroxychloroquine, lopinavir, and interferon beta-1a. In light of these results, the WHO is advising against the use of these drugs in COVID-19 positive patients. However, remdesivir was approved by the FDA for use in patients with COVID-19 on October 22nd due to the increased demand for medication treatment for this patient population. Baricitinib is a medication that was granted emergency use authorization on November 19th for use in combination with remdesivir in patients on supplemental oxygen or mechanical ventilation due to COVID-19. Patients at least 9 years of age would receive 4 milligrams for 14 days or until hospital discharge, whichever is shorter. This medication had not received FDA approval prior to the emergency use authorization and thus has no brand name at this time. The combination of casirivimab and imdevimab, or REGEN-COV2, was also issued emergency use authorization on November 21st for use in patients with COVID-19 who are at high risk of developing severe infection. The dosing is 1,200 milligrams each of casirivimab and imdevimab combined into a single IV infusion for a total of 2,400 milligrams. This cocktail is the same combination that was used to treat President Trump in October. To briefly review, ticagrelor or Brilinta was granted a new indication for primary stroke prophylaxis. Several vaccine candidates are on the way, and several medications have been granted emergency use authorizations for the treatment of COVID-19. I would like to extend a special thanks to Dr. Mary Taylor, Dr. Kushal Nayak, and Mimi for their contributions to this presentation.